Mental health and related services for children in Montana are in short supply and often difficult to access. But 2 new clinics opening in Missoula and Butte early next year hope to change all that. KPAX's Megan Mannering joins us now with the exciting details in studio. Megan.
Thank you, Dennis. These new clinics will offer services primarily to children. The idea is to help fill a demand. KPAX's Mike Dennison breaks down what specialties these new clinics in Missoula and Butte will offer.
The 2 new outpatient clinics will be operated by Helena's Shodair Children's Hospital. But as Shodair CEO Craig Osvet explains, it's a coordinated effort with local healthcare providers.
I think for the first time, we're starting to talk about how we can do things on a collaborative model instead of trying to compete with one another. And in mental health, there's just not enough resources available to be able to compete against.
In Missoula, the outpatient clinic will be on the campus of Community Medical Center, opening on January 6th. The Butte clinic is slated for opening sometime in the next 3 months, with its location yet to be determined. The clinics will provide a range of services, including psychiatrists and psychiatric nurse practitioners, speech and other types of therapy, and help for children with autism.
Child and adolescent psychiatry is a pretty scarce resource currently. There's less than 8,000 child and adolescent psychiatrists in the whole country. And one of the biggest things that we're hoping to achieve is basically being a conduit in these communities to get everyone on the same page for providing care for these children.
There's little doubt these services are in demand. Shodair opened an outpatient clinic in Helena a year ago. It started with 9 patients in the first month, and in October this year they saw more than 600 kids. Allison Young of Missoula Valley Pediatrics told MTN News that Missoula area families in need of the services are already excited about having a new resource in town. The Butte Clinic also hopes to help fill the gap created when the residential treatment center, Acadia, closed this summer.
In this industry or mental health, there's very limited services for, kids and adults, frankly. And we are, a lot of times we have parents that cannot afford to drive to Helena to have their kids seen. So it's taking services to them.
And Missoula and Butte may not be the only towns where Shodair will bring a clinic where it's needed. It's also been talking to people in Bozeman and other Montana communities. Reporting from Helena, Mike Dennison, MTN News.
Now, I sat down with Nicole Tucker at the Western Montana Mental Health Center today. She directs all of the children and family services and was able to shed some light on the mental health issues facing kids right here in Missoula. Tucker says Missoula lacks preventative measures for handling mental health issues at an early age. When you have sufficient resources, such as specialized and accessible clinics, you're less likely to see mental health worsen as kids grow older. Here in the western part of the state, Tucker sees kids across the mental health spectrum. Some she classifies as internalizers. They struggle with depression or can be hyperactive. Others deal with trauma, often from family drug and alcohol use. She said in Missoula specifically, homelessness can also play a role in children's mental health and eventually snowball into larger issues.
In Missoula, there's a high rate of homelessness is very, very much something that we all kind of see. So you have an all-encompassing kind of issues with just not only just the kids, but the parents, and then they're involved the school system or a more bigger system of like CPS or juvenile justice system. And so we are kind of in the middle of all those different systems.
While Tucker's team works to address mental health issues, she considers the addition of a new children's clinic a win for Missoula. She says the more people in her field who can collaborate and help families in our area, the better. Back to you.